So dear students, today we will talk about a case that is related to pediatrics. So we have a 4-year-old boy present with facial puffiness. So he has a facial puffiness. Important point to be noted. In the morning and progressive swelling of feet and abdomen for 7 days. So he also has progressive swelling of feet and the abdomen. Parents report frothy urine and decreased urine output. So it is again important point, and that is frothy urine and decreased urine output. There is no history of fever, sore throat, skin infection, cola-colored urine, rash, joint pain, or a drug intake that is related to a specific disease that you may know. I will discuss later. So this is a 4-year-old boy, and he has presented with a facial puffiness, puffy face in the morning, and progressive swelling of feet and abdomen, and that is for 7 days. The parents of the patient report that he has frothy urine and the urine output is decreased, and there is no symptoms of fever, sore throat, skin infection, cola-colored urine, rash, and joint pain. Now we examine the children. On examination, child is afebrile. He has no fever. Blood pressure is normal for age. According to this age, with respect to this age, the blood pressure is normal. And we also saw that the patient has periorbital edema, pedal edema in the legs, and mild ascites is also present, that there is a abdominal ascites, swelling in the abdomen. Then we did laboratory investigation, and in the laboratory investigation the urine dipstick gives protein 4 plus, and we know that normally it is negative trace. So protein 4 plus gives us a specific diagnosis that I will tell you, and you may know that. Then urinary microscopy showed no RBCs, so there is no hematuria. So let's say again the serum albumin is also 2.1, and we know that normal it is a 3.5 to 5.5. So serum albumin is decreased. Then serum cholesterol is more, 320 milligram per deciliter, and normally it should be less than 200. Serum creatinine is 0.5, normally it is 0.3 to 0.7, so it is normal. Complement C3 is normal, and that is 90 to 180 is a normal value. And now what is the question? The question is that what is the most likely diagnosis? In the option we have different option, but let's talk about the question again. So we have here, if we look at the laboratory investigation, there is protein 4 plus value, which means that there is a lot of protein present inside the urine. So blood protein should be decreased. So protein is too much, and we know that in the children we have two types of main problem. One is nephritic syndrome and one is nephrotic syndrome. So first we should differentiate that whether it is nephritic syndrome or it is nephrotic syndrome. So if there is protein plus 4, it means this is a nephrotic syndrome. But we should also see other investigation also. Urinary microscopy show no RBCs. So again this goes toward nephrotic syndrome, because in nephritic syndrome the most specific there is hematuria, and in the nephrotic syndrome we have proteinuria more commonly. So we also have proteinuria and we have no hematuria. This means this again another thing that is going toward the nephrotic syndrome. Serum albumin is decreased because blood albumin is decreased and urine albumin is increased. Her urinary protein is increased. So again this represents there is hematuria. Cholesterol is more because if protein is decreased, liver produce protein, and this also result in large amount of production of lipids, specifically cholesterol. So cholesterol is high in case of a nephrotic syndrome, and we have normal serum creatinine, normal C3. So the most likely diagnosis is nephrotic syndrome, and this is specifically minimal change disease, and minimal change disease occur inside the children. So from mnemonic you should know that minimal mean in children, in minimum people, children are minimal, that they are small. So children and minimal you should remember by this mnemonic. So here other options are also given that we will discuss, but the most good option and the most appropriate option is the nephrotic syndrome with minimal change disease. So nephrotic syndrome due to minimal change disease. We also have other option that I will discuss. This is the option that is nephrotic syndrome due to minimal change disease. So let's discuss it every option. So what about the other option? We have C is the correct option, that is edema, heavy proteinuria, 14 plus value, hypoalbuminemia, and hyperlipidemia, normal BP, normal C3, and classical minimal change disease. These are the features of a minimal change disease. And then we have acute post-streptococcal glomerulonephritis. This is also given inside the option. So if you also want to learn this, that acute post-streptococcal glomerulonephritis, we have hematuria because it is nephrotic syndrome, hypertension, low C3 and absent. Low C3 will be, so absent here mean that these features are absent in the given case. IgA nephropathy, which is also in the option. In IgA nephropathy, we see recurrent hematuria. This is the main feature, but it is absent in this case, which is given above. Lupus nephritis. In lupus nephritis, we mainly see rashes, arthritis, low complements, but that is absent. We have normal C3 values. In hemolytic uremic syndrome, we see acute kidney injury, anemia, and thrombocytopenia. That is not given in the above question. So all other options are excluded. The correct answer is nephrotic syndrome due to minimal change disease. So here we have golden exam tip. The child with edema, massive proteinuria, normal BP and normal C3 is more likely minimal change disease, which is nephrotic syndrome. So this is the case of nephrotic syndrome with minimal change disease.